Shave biopsy. Indications and relative contraindications for skin excision. To confirm the diagnosis, for example, inflammatory skin diseases or skin cancers. To excise entirely a small skin lesion. To treat hypertrophic scars. Precautions. Taking anticoagulants, allergic history including local anesthesia agents, topical antimicrobials, and dressing tape. Advantages. To confirm the clinical diagnosis in patients with skin infections, inflammatory diseases, skin cancers, and drug eruptions. To excise a skin lesion with a high risk of cancer. To predict prognosis in patients with certain skin diseases, for example, skin cancers. Process. Skin biopsy is a medical procedure using sterile devices. A biopsy site is cleaned and disinfected with povidone iodine solution or chlorhexidine. A sterile drape is then placed over the biopsy site. Lidocaine, with or without adrenaline, was injected using a small needle size for local anesthesia, and the numbing effect is tested before proceeding to the next step of the procedure. Excise the lesion by shaving with a slightly bowed, flexible razor blade kept parallel to the skin. The specimen is cut using scissors and it is sent for pathological examination. Aluminum chloride or electrocautery is used for bleeding termination. The specimen is embedded in a paraffin block and thin sections are then prepared and stained. These sections are examined under light microscope for identifying pathological findings. Thereafter, the doctor makes the final diagnosis with reported findings. Complications. Allergic reactions to local anesthetics or their components. History of drug allergy should be reported. Bleeding at the biopsy site or hematoma. Hypertrophic scars or keloids. Wound infections. Wound dehiscence. Post-procedure care. Refrain from strenuous exercise or physical activity which can stretch your sutures. Protect the wound from direct contact with tap water until suture removal. If the wound oozes, gets dirty, or soaked, do as follows. Open wound dressings and clean the wound with sterile normal saline solution or povidone iodine solution. Cover the wound with plasters or clean gauzes. Dressing wound once or twice a day until suture removal. Observe the appearance of wound infections including redness, swelling, warmth, and pus discharge. If worrisome appearances are detected, you should go see the doctor for confirming the diagnosis and prescribing antibiotics as appropriate. If you have any questions or if I can be of further assistance, please do not hesitate to contact the healthcare providers. Outpatient Department, Wililac University Hospital, Monday to Friday, 9 a.m. to 4 p.m. Telephone 075 67 3059.